to meeting this evening. Particularly would like to extend a welcome to our colleagues from West Herts Hospital Trust, and we'll do introductions shortly. And we also have colleagues from the ICB who are joining us online. So we'll go around and do some introductions shortly. But before we do we have any apologies?
Councillor Binder.
Okay.
And Kevin Minier.
Okay, thank you. So just because there's so many new faces, is everyone happy to just go around the room and introduce themselves? So I'll start to my left.
Oh, hello, I'm Lara Pringle, Councillor for North Church.
Adrian England, Deputy Leader, Dacorum, Councillor for Aidstone Ward.
Harry Link, Councillor for Apsley and Corner Hall.
Councillor Williams, Woodall Farm.
Councillor Graham Elliott, Chorlton Warner's End.
Brian Patterson, Councillor for Tring Western Rural.
Pete Hannell, Bennett's End.
Heather Pound, Cambridge.
Dan Madden, Councillor for Nash Mills and a member of the PHAT.
Rick Friedman, Berkhamsted Castle.
I'm Philip Aylett, Chair of the Dacorum Health Action Group.
I'm Glatter, a member of the public and former coordinator of the New Hospital Campaign.
I'm Edie Glatter and I'm a patient representative from the Dacorum Health Action Group.
Good evening everyone, I'm James Dime, Strategic Director for Place here at Dacorum.
I'm Jenny Webb, I'm the clerk for this evening.
Member support.
Good evening, my name is Alex White, I'm Chief Redevelopment Officer at West Herts.
Good evening, Toby Hyde, I'm the Chief Strategy and Collaboration Officer at West Herts.
So I'm going to sound really nobody now after those wonderful titles. I'm Sharon, I'm the portfolio holder for Place. Nice to meet you all.
And online.
Hi everyone, my name is Maria Kiriakou. I'm the Deputy Place Director for Transformation for the ICB. Nice to meet you all.
Thank you. So first item on the agenda is minutes of the last meeting. So for those present, were there any issues raised with the minutes of the last meeting? No? Okay, so we'll agree the minutes of the last meeting. Okay, so we'll move on to declarations of interest. So as usual, I will declare that I work for Herts and West Essex ICB as designated professional for safeguarding adults. I also work for Hertfordshire Community NHS Trust as a community nurse and a public health nurse. Does anybody else have any declarations?
Unfortunately, I'm still a paramedic with the London Ambulance Service, Chair.
Thank you. I've already mentioned I'm a member of the Dacorum Health Action Group.
Thank you. Okay. You'll notice there are some sheets of paper in front of you which just give some rules and guidance around participation of members of the public. So hopefully you've all had time to have a read of that. So what we'll do now is we'll go on to public participation, and we have had a question submitted from a Philip Aylett. So Philip, I'll hand over to you.
Thank you, Chair. The plans to replace Hemel Hempstead Hospital with a health campus appear to fall short of what's required. The current design on a constrained site will result in a building that will, it seems from the information that we've seen up to now, only be big enough to accommodate the limited services planned for Hemel by the West Herts Trust. But why are the West Herts Trust plans insufficient? To give just one example, the Trust's detailed figures for future patient numbers, which were submitted to a Trust board meeting last year, assume a 6% rise only in cases at the Hemel Urgent Care Centre over 17 years. That seems to me to be completely underestimating the likely future demands of our growing and ageing population. The failure to provide enough urgent care will, of course, also put the pressure on Watford's own Meanwhile, for Watford General, the picture is very different. Over the same 17 years, from 2019 to 2036, the Trust plans substantial increases in emergency provision, 32,000 more attendances at the emergency department, a 30% rise. I don't know what the policy is behind that, it doesn't sound very sensible. Outpatient appointments and procedures, there'll be 20,000 more of those against a modest 4,000 increase for Hemel. This continuation of the Trust's long-standing tendency to level down means many more congested journeys to Watford for Dacorum people. Instead, I think we deserve accessible local services. As a Hemel resident, some years ago, I was part of a small group that tried to think of things to do with the Market Square. It was a council group that was set up. Don't think we got too far, but anyway, I certainly see the need for regeneration. And if the NHS is genuinely willing to consider properly the interest of patients in this area, there is surely an opportunity to see whether some of the resources devoted to Watford General could be diverted instead to local provision for our borough. If a wide range of health services could somehow be provided on the Market Square, that would be good. Although I have to say there is some scepticism among the group about whether there's enough space there. And there's concerns about parking and access. However, there are no healthcare benefits at all in spending millions on a new building. There's no substantial uplift in local provision. We agree with the concept of integrating services on that site. One thing should be clear, we should seek to get the best range of hospitals and other health services for Dacorum, then decide which site would be best. The current site at the Hemel Hospital contains some buildings which are in reasonable condition despite years of poor maintenance. Plans for work to the fairly new Verulam building actually were approved by the council at outline level last year. The current hospital site offers the option of space for clean beds in the event of another pandemic. As far as I can see, that would not be available on the potential new site. So Hemel Hospital, I think, must not be abandoned without proper consideration and full consultation. I know that the Trust have at times been very much against consultation on major changes, and I think that's something we need to change. So it's important we don't miss an opportunity to improve our health services for the future. I urge the council to enter into negotiations with the NHS to try to secure for Hemel Hempstead substantial increases in the range and volume of services for the area beyond those planned by the Trust. I would just say, I think I will repeat the question, which is, will the council enter into negotiations to try to secure for Hemel Hempstead and Dacorum generally substantial increases in the range and volume of services beyond those currently planned?
So, obviously, services will be so now we will hear from West Herts Hospital. What we look for further down on the agenda, we have the health campus. As the cluster here, are you happy for the health campus to be combined with that? And over to.
Thank you very much. The update is specifically update.
Not really. I don't think there's anything other than if you'd like to talk about the total amount.
Yeah. Okay, well, thank you to everyone who's having this again. It's great to be back. We are a fairly new person, but we understand that it's been too long since being here, and we look forward to renewing our relationship with you and working with you collaboratively to develop what we think is a very exciting prospect for Market Square potentially. And we were delighted when Dacorum came forward with this proposal. We think it's a great opportunity. It's very, very early days. And what we're looking at right now, I think Dacorum colleagues would agree, is the art of the possible. And we're working closely with the ICB and other healthcare partners to look at exactly what range of services could go in here, and how that will integrate across the region, across the system, and enhance the offering already provided here. I have to say personally, looking at it from almost like a town planning point of view, it makes an awful lot of sense in terms of consolidating and rejuvenating the centre and then making best use of the existing campus. But I have to say, from the trust perspective, we're committed to working collaboratively with everybody, engaging in very meaningful engagement with everybody in developing the services that go in there, re-looking at the demand and capacity analysis and making sure that this is future-proof in terms of activity volumes well into the next decade and beyond. Making sure this is an adaptable and flexible building, that it's a smart building, digitally enabled, and bringing in the best innovations that we can possibly foresee at this point in time. So it's an incredibly exciting opportunity, and on behalf of the Trust, we look forward to working with you in developing it.
Anybody have any questions?
Yeah, I do. I wonder if you could reassure us that the campus would be able to provide for approximately 80% of the health needs of Hemel Hempstead outside of GP surgeries, as a fully functioning urgent care centre should.
I couldn't comment on that right now, I'm afraid. I mean, that we would ensure that everyone is involved in the demand and capacity model, and that is done behind closed doors, as it were, that we involved everybody in ensuring that everybody is cited on the assumptions that underpin the activity modelling that goes into that building.
Can I ask a question, just to make sure I understand? The 80% figure, how can I just understand a bit more as to how that's derived? Or?
Yeah, I mean, it's the view of the Labour group and the Borough Council that any replacement of what we've got in Hemel Hospital should be able to cater for everything that's not A&E. Fully funded and fully functioning urgent care centre should be able to provide for a roughly 80% of the health needs of this town or of this borough.
So perhaps if I could just add a few points as well to Alex's summary. I think clearly that the really important thing here is to make sure we have a shared understanding of the current and future needs of the population in and around Hemel, and I completely acknowledge the points made about the impact that that currently has on demands for things like urgent treatment centres, etc. Really important. The second thing then is to say, what is the best model of care to support that population in the future? And I think it's fair to say that our existing model of care in the NHS is not always conducive to treating the population that we'll have in 10 or 20 years' time. So, for example, what we know locally is that there's a growth in the number of older adults that are living locally, that more people tend to be living with multiple long-term conditions. And therefore, it's really important that we start to develop teams that can work across organisational boundaries to care for those people. It's great having Dr. Fernandez in the room. I think one of the things we're looking at the moment is how we bring together those multidisciplinary teams, working with general practice, to be able to care for people in a way that minimises the need to travel into an A&E, for example, or to end up in an inpatient bed in hospital. So I think it's really important when we think about the opportunity of this new facility that we don't just think shifting ways of working. We think and reimagine that current future.
Just picking up on that last point, I think there's a gap between the ability of the NHS to envisage the ability of the local population, and you've got that. Urge you to really try to come down to the common, no disrespect, myself and but come down to our level and talk in normal language I've been trying to do, because for as long as I've been around, there's been a really clear conviction that a town like Hemel should have its own general hospital with all the bells and whistles. And I think you've got a massive task if you think you're going to change everybody's mind on that. I've been to all the Your Care, Your Future, whatever they were called, sessions in the last few years, and I understand your vision to try and locate as much of the really specialist stuff in place, so that you can manage staffing more effectively and all the rest of it that goes with that. And for a long time, I was of the opinion, I still am of the opinion, frankly, that ought to be located in a greenfield site. But I'm attracted by the possibility of this health campus for what it can do more quickly, disassociated from that project. But I think that there's still a big job to be done to reach people and to explain what we're trying to do. From a council, it's really important that we are positive and constructive about everything that we do in this space. And that's always been my attitude, and I continue to be that way. But I really want to see this project moving as quickly as it possibly can. And I really want to see people in the town that really needs talking their language.
Yeah, absolutely. And just to say, I think local elected members could play a really constructive role. I know, we know, that in the NHS there is a tendency to revert to kind of technical healthcare acronyms and language, etc. We need to find a shared way of describing our ambitions for what this could be in a way that residents will actually understand. So just kind of defer to your collective expertise, I guess, on how we best do that. And another reason why I think we're very keen to work with this.
I just would like to encourage you on the basis that Hampstead as a town is going to be massively increasing in population over the next few years. Even the bit that is St Albans is actually really going to be in Hemel, of course. We need an urgent care centre that's open 24/7 again, because it's ridiculous already that we have to go to Watford after 8 o'clock, is it now that it closes? 10, is it? It's open till 10, okay. But the queues at Watford overnight are already really long. I know that from experience. But we're already the biggest town in Hertfordshire. So I would really urge you to please open a 24/7 urgent care when you go through these plans. Thank you.
Any other questions? Councillor Patterson.
You said, I think that you were going to deal with cases from, first of all, Hemel Hempstead, and you corrected it to the borough. And I'm wondering what your catchment area is and whether it's expected to change in any way, because at the moment Tring isn't really in your catchment.
The things we're asked to do first off is to look at what the existing catchment is. That would be really easy. Look at, I guess, the next thing is looking at the existing flows, if you will, and how people use future populations and what that might mean in terms of services in the patch. Really important to recognise as well the breadth of fantastic community services, general practices, lots of other teams working around the patch, and we need to think about how this operates as part of a kind of wider network of paramedics, ambulance services, etc., all working in the patch, so we need to think about how we net that together.
Sorry, I'm going to be a bit of a wet blanket, but I can understand the council's dilemma. Site has been maintained ever since A&E moved to Watford. That was in 2009. And what to do with the Market Square. This sounds like the perfect solution. Pleases council, pleases I am disappointed so far with the lack of any real vision up to now on what we can have for our growing, as Jan has said, our growing and our ageing population. Residents, I'm afraid to say, are already seeing the proposal as the closure of the hospital. Resist the idea that it's just one of the quotes. It was Hemel. We're not just. I think clearly calling the proposed building a Market Square, Hemel Hempstead, means that the building will not be a hospital. It's certainly it's to keep through its race, it doesn't cover it. It could be one building case. But I understand why your comment about this is not before the hospital. Present services is not a hospital. This is acceptable. I would say that the residents like the social necessarily A and other sizes of hospitals, but certainly needs to provide more than is being proposed. Yeah, you can carry on. We have finished there actually, but I look forward to seeing it come out of the collaboration. There is some good services and something really good.
We'll move on to hear from she's having audio. She's having audio. She's very quiet. Hopefully she will hear us. So just keep out her to serve and increase the vehicle. Are you able to hear? Yes.
It's complete from what we talked through. It's probably going well.
From the IC, you already have
Yeah, I've got plans of GP located on, I work there for the.
Maria's. Oh, can you hear us now, Maria?
Intermittently, so.
So Maria, we were just coming over to you for first of all, welcome to the meeting, and then just wondering if you had any updates for us about the ICB, and anything you'd like to share with this group.
Absolutely. I guess the question first, would it be helpful to give a couple of minutes overview on the ICB? Or does everyone feel really comfortable with that? Yeah. Okay. Okay. So I'm just going to share a couple of slides. I will take them down, but it's just slightly easier. So do bear with me. Can everyone see that?
Yes.
Fabulous. Okay. So within the integrated care board, we have a population of 1.6 million, and we cover 3 areas. So South and West Herts, which is where we are, East and North Herts and West Essex. So covering 2 county councils, 13 district and borough councils, a mixture of 4 mental health and community providers, 130 GP practices. So as you can see from the diagram, we are a large group of health and care providers coming together. The Integrated Care Board was established on the 1st of July 2022, and it's the NHS element of the integrated care system, and it plans and oversees how NHS money is spent and makes sure health services work well and are of high quality. The ICB's role is to join up health and care services and improve health and well-being and health inequalities for our residents. The Integrated Care Board is one of 2 components. One of them is the integrated care system, and the other one is the Integrated Care Partnership. So just to move the Integrated Care Partnership, it provides a forum for the NHS and local authorities to come together. So this is where we collectively come together as equal partners alongside a broad alliance of organisations concerned with improving the health and well-being of our population. The forum allows us to agree shared objectives and work on joint challenges. And as you can see on the table to the right, we have jointly articulated strategic priorities as articulated in the integrated care strategy. So I'll just stop there on those. Hopefully that's enough, and I'm really happy to share these slides. I thought next we could go over to Trevor for a bit of a slightly more detailed look at what's happening in Dacorum.
Thanks, yes. As you'll probably remember, when I last came here, you were probably dealing with CCGs. So the main difference between this and CCGs were a board of GPs who commission services on behalf of patients in an area. All right. There are 2 things that have mainly changed. The size of the area, because we just did it for that south and west patch. So now it's the whole of Herts and West Essex. And the second thing is we're all working together. So we work with, and we all have a say together. So with West Herts, with the Community Trust, with the Ambulance Trust, with the Mental Health Trust, with the councils. And the theory is that it has a lot of benefits. You know, before we worked as health, you worked as councils, we sort of informed each other what we were doing, but we didn't really work together. And now we mentioned ageing populations, we've mentioned increasing populations, and the honest answer is the only way forward for the NHS is more prevention. So this gives us the opportunity to do better on those things. The social health compartment together for the ageing population, and working together on the prevention agenda. Because unless we do more on prevention, then the NHS is not going to be able to provide the services that we expect, because the demand will be far too high. And we've seen that. We've seen that. We look at the numbers of diabetics, we look at the numbers of obese people, look at the number of people who have smoking-related illnesses. Those are all the things that create health problems. So just going back to Edie's slight point, I think a campus is a really good idea, because there's a whole thing about the determinants of health, and only 20% of them are in health. The rest is housing, employment, education, and lifestyle. And that's 80%. And the whole point of having a campus is we can work on that 80% together. And that's where we really need your help, because that's what we're going to be doing. So Maria gave you all the theory. I talk about it as what it gives us the opportunity to do. And we've just started on this journey. As with every reorganisation that comes down from government, you lose 2 years. You know, you basically have everything running quite smoothly. We were commissioning quite well. We're getting on with West Herts well. We were actually talking more to the council. We were doing all those things, but they decided to throw it all up in the air and start again. And then there was COVID, which meant that it all moved a lot slower than it should have done. And therefore, we're only just getting going on the work. So I haven't got a huge amount to report to you, but I can tell you what we're working on and how we're working. So just going back to what I was saying previously, the whole point of this is looking at the needs of the population. Okay, and believe it or not, actually, nationally, we're actually quite a healthy bunch. But there's always improvement that can be made. And so, and what's changed over the last 5, 10 years is IT, is data. We have got so much more data than we had 5 years ago and 10 years ago. And I think probably, you know, there's a fair point there on the increased need, and we will be able to use data better to work that out. But what we are doing is looking at data that is given to us, both council and health. And again, we're merging the data we have to see what the population really needs. And so we've looked at what we call locality data packs. So that covers Dacorum. And the 3 things that came out were the frail elderly population. That's huge, you know, and that's to do with people's quality of life. It's to do with social care, which we know is strapped. It's to do with services in the acute trust in West Herts. And you know, and if we can keep this group of population healthier, then we've got a better chance of everything running more smoothly. So what we're working on is what we call anticipatory care for the frail elderly. So what that means is trying to work out what's going to go wrong with them before it happens. Okay, it's trying to work out where people are vulnerable, where we can make a difference. And so there are 2 projects happening. One's going to be in Berkhamsted, one's going to be in parts of Hemel, amongst with 2 of the PCNs. One of them is mine, Beta, and I'll just, PCN acronym, Primary Care Network. Primary Care Networks are, I'm going off piece now, so here we go. So are groups of GP practices who work together, okay? And basically, as you see, everything's got bigger. You know, the Herts and West Essex things got bigger. That means there are an awful lot more general practices. And basically, trying to commission with that many general practices needs an awful lot of people in the back offices. So if you can actually have bigger units, there are a number of things. One, it's easier to work with bigger units. 2, those units might be able to work together, so they need less staff in maybe admin or HR or whatever. And thirdly, and we found this in COVID, it gives practices more resilience. All practices, just about that I know of, are under-doctored at the moment because there aren't enough doctors. Where you're bringing in paramedics, nurses, anyone we can find to try and prop us up. But practices working together gives us some resilience. So if something falls down, you know, there are other practices linked by IT who can help out. So example, locally, literally up the road, practice has a flood, they come and use the offices up at Parkwood Surgery. All right, so it works. There's a journey to go on this. We're still working pretty much as individual practices, but it's going to get more together. So hold on, that's back to PCNs. So in 2 PCNs, which are groups of practices in Hemel, so there are 4 of them, not in Hemel, in Dacorum. There are going to be projects on frail elderly, and they're just getting going. And again, this is the sort of reason why we might need different types of estates rather than the traditional hospital to help us do this work. And there are certainly projects that the Trust's working on, that we're working on, that, you know, we could use this type of estate for, as well as, you know, practices. Again, if we look at our data, there's another, there are other problems, obesity, childhood obesity in certain wards in Dacorum. And those of you who've seen the locality pack will know that. And again, we've just had 1 or 2 meetings with the council, and actually we're beginning to think differently. We don't have to start a new project and throw money at it. but hold on, they tell us, actually, we've got a couple of adventure playgrounds over there. All we have to do is give out some free spaces in the holidays and get people running around more. Yeah, and that's where it's being really clever. It won't cost any extra. You're running the adventure playground anyway. Having a few more people in who are at risk of poor health actually is really useful. So that's the sort of simple thing. That's the one example that comes off my top of my head. There's adult obesity. And again, using the neighbourhood hubs, the health hubs, to encourage exercise classes, try and draw in maybe minority groups who might not traditionally exercise, try and tailor it to groups of people. And we now have data that can tell us which groups of people aren't exercising, which groups of people are overweight. And together with the councils, we can target those groups. And then, so that's childhood and adult obesity, actually. And then cancer screening, we stole this from Hertfordshire. So, other boroughs have good uses. They've had a project where, again, maybe ethnic groups or certain areas have poor uptakes in cancer screening, whether it be cervical screening, breast screening, bowel screening, all of those things that will prevent illness, that will reduce the burden on the NHS. And what we want to do in conjunction with the council, again, using health hubs or healthy hubs or whatever, is actually try and promote these prevention services to those groups. So it's all about targeting people and what's different. And, everything's going, IT wise now, isn't it? Everything is virtual. Everything is about big picture, and actually although it's big picture and big data, we can drill down to the people we really need to. And for that, we need communities. We need hubs. We need all those things. And that is what's going to bring us the biggest effect going forward. So just going through the rest of the things, these are projects that are sort of up and running or maybe some on the back burner. There's ADHD at the moment. I should know what that means, but I just so used to saying ADHD that I can't remember. Attention deficit hyperactivity disorder. Just took me a second. Yeah, it's an epidemic at the moment. There's a huge backlog with diagnoses. So many people are coming forward and saying, well, I think I might have it. I think the wait at the moment is something like 2 years for an assessment, certainly for adults, and not far behind for children. And we've got a project where we've got local GPs who, and this is through the GP Federation, a group of GPs who work together. We're doing some of the follow-up work to give capacity to the Mental Health Trust or HCT, I can't remember, it does HPFT, yeah, to the Mental Health Trust to see more new patients. So that's an example of that. Well, leg service, again, it's about people with leg ulcers and working between community, general practice and specialist nurses to give better services. There's pharmacists, we mustn't forget pharmacists, really important, doing so much more now. And they can see people with suspected urinary tract infections, again, taking something relatively simple away from general practice so we can do more stuff for more complicated patients. Again, back to the prevention, sorting out a website and an app to get more people active and doing exercise. So those are all the sort of things we're doing. Active aging and working on that, trying to keep people active. My tips are, anyone who's getting a bit older, when you're brushing your teeth, stand on one leg, 1 minute on one leg, 1 minute on the other. It could save you falling over and breaking your hip, okay? Second thing, get out of a chair without using your hands. Third thing, take your shoes and socks off without sitting down. These are all simple things that if we can get out to people, it'll help them to age better. Anyway, so it's just a slight mind change from going along, getting ill and going to hospital to actually trying to prevent people getting ill. There's still debates to be had on capacity and services in the hospital. I'm not trying to get away from that, but what I'm saying is this is really important and this should be taking up a lot of mind space for us. That's my bit from what we're doing at the moment.
Thank you. Any questions for the ICB, whether it be Trevor or Maria?
It might be another slide, it wasn't mine.
Yeah, there's. I've just got a couple more things, if that's okay. So just in terms of updates, our MSK provider is changing. So Circle Integrated Care have undergone a rigorous open market procurement process. And they are coming in on the 31st of March, and there'll be a full handover from the current provider. There are changes in terms of patient choice. Some national changes have come into place if people have been waiting longer than they should for planned care. So anyone waiting over 18 weeks can now write to their hospital to request a change. And just a few updates in terms of preparation for winter. We've commissioned an extra 6,134 appointments to be made available between October and March 24 in general practice in Dacorum. So hopefully that should have an impact. And then a new scheme has been put in place where if anyone dials the 999 centre, any appropriate call to the urgent will go to the urgent community response team, which is hosted by our community provider. And instead of an ambulance response, the team may send a district nurse or a physio, whoever they deem to be appropriate. So another opportunity to provide care in the appropriate place. And then finally, the commissioning of more discharge to assess beds has been put in place. So on discharge from hospital, there's a longer assessment process to really support people to be discharged back to their homes and re-enabled for the longer term. So that's it from me.
Thank you. We'll just see if there's any questions. Councillor Madden.
Question for Trevor, actually. I was aware of the pharmacy prescribing on certain conditions now. I would just like sort of some clarity on that.
Sure.
So supposing you have a UTI or any of the other conditions that qualify for this, and you go to see the pharmacist and they give you a prescription, does that data go back to your pharmacy for your records?
So the GP practice, yes,
Yeah.
there is communication.
Okay, that was all really, thanks.
And they also, I think there's now a scheme where they do blood pressure monitoring. So again, taking simple stuff away from us. It may be if we've started someone on new blood pressure tablets, they can do the sort of checks just to make sure the blood pressure looks okay.
Thank you.
Thank you. Councillor England.
Yeah, thank you for that presentation. I've got a question, but first of all, a quick comment on that. What I'm hearing, sorry, Edie, I am looking at you, is I'm hearing a vision, but it's not a vision for buildings. It's a vision for transformation. It looks to me, looking at those figures of, you know, the 6% and the 30%, I'm not going to say it's all of it, but it looks to me as if part of the difference in those numbers is because of the vision that Trevor's talking about, i.e. reducing the need for people to go to hospital.
Wonderful.
It would, wouldn't it?
Yeah.
I mean, my stepbrother won't go near a hospital, and we all know people like that who just absolutely focus. If we can find ways to treat those people and have those people living full and active lives for longer, whether it's standing on one leg or anything like that, I'm not sure whether we've got. Well, I'm seeing you doing some videos that could go viral on social media.
And they get really good at it. You dip while you're doing it. If you do that.
So
yeah,
I think there's some good stuff in there. What's in my head is I've heard of this idea of virtual wards, and I don't understand it.
I mean, I know. I can take you start that. You want me to go first?
You go first.
I'll go first. Fine. And I say part because I look after the virtual hospitals on my weekend. Would it be helpful if I just try and bring it to life what that actually looks like in very practical terms from a patient perspective?
Yes.
So there's a few different ways onto a virtual ward at the moment. You can either be what what we call onboarded, so kind of taken onto the ward from a community perspective. Onboarded.
Careful.
That's
not common language, is it?
Well, I know, sorry.
We need another word.
We'll find another phrase for that, granted. But so you can either access the virtual ward from a community perspective, so that might be via, for example, a community nurse, or we also identify people in the hospital, so that might be an A&E or on the wards, that might be able to go home a bit quicker under a virtual ward model. What that means is that you'll get some devices to take home, or a device to take home, and what that allows us to do is track a series of different vital signs for patients who are on the virtual ward. Often community nurses will come and help with some of that to make sure people really understand how that's going to work and make sure people understand the tech. And then we have a virtual ward hub, which is basically, if you imagine...
Sorry, can I just interrupt? Because there's two conversations going on, it's hard to hear over here, so we'll, and it interrupts the cameras, so, yeah, sorry.
Sorry, so once you're on a virtual ward, we then have a multidisciplinary team of doctors, nurses, etc., based on the Watford site at the moment, and they're able to track on a big wall of tallies. They've got all the vital signs for all the patients on the wards that come through, and then they're on the phone all day, calling those patients where any of those numbers look like they're going in the wrong direction. They're constantly checking in if people have any change in symptoms, for example. And what that enables us to do is to look after a group of patients. And at the moment, we've got about 100 people that look after small groups. And we can look after about 100 patients at the moment with that team, that virtual ward model. And if anyone needs it, we can send out community nursing that we can see people. We obviously bring people back into the hospital. If anyone is interested in seeing what that actually looks like, very welcome to come. I don't know if you want
Yeah, examples would be someone with who turns up in A&E, they come with pneumonia, and you have a couple of doses of antibiotics into a vein, and then being followed up at home. And the idea of that is actually people are more mobile at home. People can, you know, three days in bed and you've lost 10% of your muscle mass. Okay. People prefer the food at home. Definitely. Yeah. So, and this isn't for everyone. Some people might not have circumstances where this has happened. Again, one has to take these things sensibly, and it's only if certain criteria are in place and they've got a relation at home who can do that, and they've got a suitable home. And so we don't have to say it's a blanket thing for everyone. That's the key thing to say. We're not making everyone do this. This is where it's probably beneficial for the individuals and will help them recover quickly. Okay, so I think that's going to be the key point.
And just to say, it's constantly evolving. We're only about 18 months or so into the process of setting up and running virtual wards. Just today I got a message to say we've just had our first patient home early on a surgical virtual ward. So having elective surgery, we've managed to get them home a bit early on that kind of pathway. We're going to look at children and how we can support some of the kids that are coming into A&E and see if we can get them home a bit quicker using virtual ward technology. So we'll constantly iterate and evolve over the course of the coming years.
And presumably, there's less risk of hospital-acquired infections if they're actually at home.
Inevitably, yeah. And just to add to Trevor's points, the feedback we get from patients and their families is very positive.
Thank you. Any further questions for either the ICB or hospital?
Can I just ask one question? Interested in the issue of the emphasis on prevention, and Edie did a lot of work on this. We put forward a vision for Dacorum services, and that really would include quite a lot of prevention clinics in the various areas of diabetes and so forth, which might be co-located in a hospital of some sort. That's something to think about. It's important to think about that as part of the whole picture.
Definitely. And obviously we'll take on board what Jim McManus was saying to us at the last meeting, and that's all going to feed into these. Sorry, I think I had a hand here first.
So just in terms of what you've just raised, which is prevention, and linking it into health inequality, because I believe that statistics of, the longevity in Kensington compared to somewhere in the north of England, there's about a 20-year life expectancy difference. And a lot of that must be due to access to wellness and mental health services and that sort of thing. And I've noticed that there's a big boom in the wellness industry at the moment, with lots of people privately going into that. And some of them are investing in some very expensive but very exciting equipment that could be used to treat all sorts of people. And I was wondering if, during the downtime, for example, if that equipment, if we could buy the use of some of that equipment to buy block bookings of it for our GPs to prescribe the use of certain equipment that would help to deal with various symptoms, for example, after childbirth and so on. I understand there's some quite exciting equipment out there for pelvic floor exercises, for example, which could really change a lot of people's lives. And yet the private practitioners are running this as a business. It's sitting there all day on a Sunday, not being used. It's sitting there after the hours of 5 o'clock. We could book out at a reduced rate block bookings of that with someone just to go down and administer it as a sort of clinic within the community that could be prescribed by the GPs. And I was wondering if there's any scope for looking at that, because some of my informal inquiries with the providers would mean that they would feel more secure in investing for their business, investing in some really exciting equipment, if they knew that they'd have a baseline demand from local NHS services.
I mean, I'd never rule anything out. Certainly worth looking at. The issue's always going to be money at the end of it, and if you spend some money on that, it might not mean money for something else. But in theory, I think, yeah, it's very interesting, and certain things that, going forward we could look at.
Because I think a lot of these things can help people with severe depression, mental health problems as well, that the physical therapies sort of are complementary to psychological therapies as well. And I know that we can prescribe. Right. If we can prescribe swimming lessons, surely we could prescribe 20 minutes on a piece of equipment that has. I don't think that our local GPs or our local health services can afford to invest in these things necessarily just for the NHS, but it seems a real shame that people who can afford it can get these services, and people who can't.
I mean, it's interesting. Years ago we used to have schemes where we could refer people to the health, the fitness place, leisure centre. That's the one. And the problem is funding. Most of those schemes have been wound up because there's no money. And both in your sector and our sector, and no one's got the money to pay for it, and that's the problem. So I think that's really interesting, very promising, but I think we might also have to focus on free things or very cheap things.
So basically, if you need some pelvic floor therapy to get out with your newborn, that's equipment, but being told to stand on one leg while you're cleaning your teeth.
There is equipment that can be prescribed for that. But people need to do the exercises. That you don't always need high-tech kit. High-tech kit makes it easier sometimes. It just doesn't,
Well, I think that there are.
But there are probably things that are coming up, and as they become more mainstream, there might be funding to do that. But I can't say. I'm saying it's definite. I said it's interesting, and we could look at it. But what I'm saying is, I think money's really tight.
Yeah,
we've got a 38 million deficit in the ICB at the moment. 38 million this year, and we've got 3 months to go.
I think it's good to recognise that we might have hit on an idea tonight.
Yeah.
Let's as I said before, let's stay.
I'm open to anything that gets people doing stuff, and if there is equipment that's simply accessible for a reasonable price, we might be able to use it.
Yeah, thank you.
Thank you.
So, Mr. Glasser, I noticed you had a question.
I'm not sure whether this is really a question for the ICB or for the trust.
We would need to keep it brief simply
Yes,
because
I
we
will.
haven't had notice of the question. And thank you.
It's just that since 2019, the whole argument that the trust have put forward about how they want to create the redevelopment of acute services is based on the notion of a 3-site model. That's the whole basis that they've argued it, month after month, year after year. Is that still what they have in mind for acute care, a 3-site model? And will there therefore be a really acute site in Dacorum?
So the short answer is yes. The slightly longer answer is to say what we are describing is about the best place to locate health services within Dacorum. The mix of services that will be located in the health campus that we were describing earlier in the meeting would be the same as the services that we've set out since 2019. I think what we're keen to do as part of that, and building on what Trevor's described to you as well earlier in the meeting, is to also look at what's the model of care, how do we best organise those health services to get the best possible outcomes for the local population. So the short answer is yes.
Thank you. Councillor Friedman.
Thanks, Chair. So my question sort of falls under a different heading, but because we've just been talking lots about prevention, education and public health, I want to throw it in here, where obviously we're labelling the proposal as a campus. So my question is, what do we have any intentions for it for research, and what sort of research would we be thinking on this proposal? Because I'm guessing that we don't have too much inpatient facility for that.
Yeah, I mean, I'm happy to kick off, Toby. Go ahead. Go on.
So it's a really interesting question. Part of my hesitation is we haven't actively considered the role of research in this facility yet, but I think it raises a really important question. One thing I would say is the trust has recently gained teaching hospital status just in the last couple of years, and that does present some really interesting opportunities about how we start to build our kind of research capabilities, working with local universities, etc. So I think there's huge potential there. I just don't have an immediate answer to your question, but I will take that one away, and I think really good to build into the next phase of discussions on this.
Okay, thanks. That's the answer to my main question. I'm just curious, why was the title of campus selected? Because that's why I was thinking that you may have thought of research already.
I don't think. I think Dacorum would be the best place to answer that.
Yeah.
Can I come here, Chair? I mean, I think the title is absolutely flexible, really. It's calling it something, really. It may not be called a campus at the end of the day. I think it's just to give this overview that this is a range of health services on the site. And I think it also tries to pick up what Councillor England was actually saying about, you know, the phobic nature that some people associate with the term hospital as well. But we've been doing some work, just to build on what Alex White was saying a little bit earlier, over the last few months with the ICB and the Trust, really, to establish what might be possible to put onto the market square to just collect health services, however the NHS wants to deliver them within Dacorum, under one roof into one location. So it would be a place where health would be promoted within Dacorum, as well as receiving the right levels of care and so on. But of course, that's very much in the NHS's hands to set out what they want to deliver, and in our position as both a landowner and of course a planning authority as well, how we can help deliver that within Hemel Hempstead Town Centre.
Thank you. Thank you. Thank you very much for all the answers. Really, really appreciate your attendance today. So thank you. So what we'll do now is we'll move on to our Health Scrutiny Committee report. Now, this is going to be quite out of date because we never managed to cover it at the last meeting because we gave Jim McManus more time. So if we could keep it fairly brief, because I know there'll be an update fairly soon when the next scrutiny comes up.
Well, it will be fairly brief because I was prepared to give it the last time round and I haven't brought the same notes with me. So, but if I just describe what happened on the day, we met on the 19th of.
Yeah, sorry, I think our ICB colleagues are wanting to go. Hospital College, you're welcome to stay or you can go as well. It's entirely up to you.
I will not have to if that's okay.
Yeah, thank you very much.
Thank you so much for coming.
Thanks for having us.
Really brilliant.
Good evening.
Thank
See you
you.
soon.
Take care.
So thank you. So just to describe what happened, this was a meeting at County Hall that took place over a full day on the 19th of July, and we had representatives from every borough and district council as well as county councillors. And we had the 3 ICBs that provide healthcare across Hertfordshire answering questions, and the councillors divided into groups and put very specific questions to them. And there was a lot of content, a lot of very good scrutiny going on there. As I say, I can forward the full report in writing after the meeting, but just to touch on some of the things that we discussed. One of them was the lack of a Dacorum representative on the Watford Trust and the fact that we're not properly represented. And we did ask about that. And we expect that there will be some proactive addressing of that problem, because when we're talking about the issues that we've discussed tonight, it's really unacceptable that we don't have Dacorum voices there when key strategic decisions are being made. I think a lot of residents feel that we're somewhat of an afterthought when strategic decisions about our healthcare are made. The other thing that came up quite a lot was about ensuring that people have a proper package of care when they're being discharged, to ensure that duty of care is passed over in a responsible manner, because we hear stories of elderly people being discharged at all times of the day. Maybe they're not mobile and they can't get up and get themselves food. Maybe the food in their house is all out of date because they've been in hospital, etc. Maybe they don't have clean sheets available because of the circumstances in which they're taken into hospital. So that was raised a lot, that it was considered very important that there should be a handover of duty of care to a named person in the community or family member that would be taken care of within, by the next lunchtime, for example, to ensure that people weren't being discharged home left without heating, food and provision. And that it was also raised actually by some of the care providers that the cost of living crisis is having almost, it's very understated publicly, the impact that is having on people. There was a discussion from a care provider saying that people on her ward were coming up and confiding to her that they couldn't afford to actually feed themselves, and they were really worried and didn't know where they could get help from in doing that. And so that's something that is really quite shocking, and it's just worth mentioning because we don't expect, there's people that you wouldn't necessarily expect being in that cohort who are having difficulty actually just making ends meet, which will have an impact on their health. And another matter that was brought up was special educational needs and access to that. We know statistically that there's some quite horrific figures coming back about how the life expectancy of people with special educational needs is significantly lower than that of neurotypical individuals. And a lot of that is to do with access to healthcare. It is positive to see that some GPs have improved engagement by having, for example, annual health checks where there's a proactive measures are taken to call in people with special educational needs for general health checks and to remind them regularly how they might access healthcare. But that doesn't seem to be uniform across hospitals and outpatient departments. It doesn't seem to necessarily be the training in outreach and making, you know, coming to a hospital appointment more accessible for someone with special educational needs. So those are the things that I can remember back from July that were raised, but I will write up my, you know, I'll send the report in writing. Yeah, so unless anyone's got any questions, that's the sort of summation of it.
Thank you. And yeah, if you could share that.
I will do, thank you.
If you could, are you able to share the minutes of that with me?
Well, the last time I checked, we were still awaiting the minutes, but I will forward them through.
Okay, thank you. Any questions? No? Okay. We don't have an adult care services report, do we, Jenny? No. I was just checking. So we don't have that. The health campus, obviously, we've already covered. What we did miss was the ward issues. Now, what I tried to do is have updates in writing because I wanted every councillor, not just the councillors here, but I wanted all the wards, if there was any health issues, to update us. But within a variety of emails, I think there was a delay there. So we do have a couple of ward updates. So Councillor Guest have award updates been circulated to this group? No. Okay, so I just wanted to check. So sorry, I'm just getting them. I had it up on the screen a moment ago. Just bear with me. It was here and then it's gone. Okay, so Councillor Guest had a specific question, which I think we'll need to take away. But she was asking about the state of recruitment of GPs and other required healthcare professionals at Parkwood Drive Surgery. Actually, it would have been good to ask this question a little while ago. That would have, but actually we can circulate that question and see if an answer comes up. And how many of each professional does it have compared with its full establishment? So I think we can contact the surgery or and get that information and share with Councillor Guest. We also had a brief update from Councillor Hannell, but as Councillor Hannell's here, do you want me to read it or are you happy just to?
I've got a report. I don't really think that number 5 should be ward issues because I'm going to give you a report. I'm not an issues-based person, to be honest. I'm telling you what's happening in Bennett's End. So since I got elected in May, I've been working with West Isles Sport Partnership to use sport and physical exercise to address inactivity, social disadvantage and health inequalities in Bennett's End. There's no direct funding available to Bennett's End to assist with this ambition. However, Heart Sport Partnership are able to assist through their bid writing service to assist local groups to apply for external funding from groups such as Dacorum Borough Council, Hertfordshire County Council, Sport England and the FA. Bennett's End Active Working Group was set up to bring local partners together to look at how we could all work more closely to achieve our ambition of improving mental and physical health of the people who live in Bennett's End Ward. We now have 20 partners, including the GP surgery, Longdean School, the Healthy U Gym, which is our women's only gym facility on Kimps Way, everyone active at the Sports Centre and Bennett's End Community Centre. It's quite short. Over the last quarter, July to September, we've been able to achieve the creation of 12 new health and wellbeing partnerships, supported 11 projects and secured over nearly £72,500 of invested funding. Working with this Borough Council and Longdean School, we've chosen 3 key priority areas for 2024, women and girls, obesity, and also improving and expanding our working group. Examples of invested funding including subsidised Wildcats introduction to women's football, teen gym for girls to improve girls between 11 and 24 mental health and physical activity, and that takes place at the Healthy U Gym, social prescribing via the GP surgery, to Pilates, yoga and walking groups. I know that some people here use some of those groups, with classes in the community centre and the local area. Finally, we're working with the 6th form student group at Longdean to find out what young people want and to demonstrate a tangible link between physical activity and improved academic performance. Our next meeting is on Monday the 4th of December at Bennett's End Community Centre between 10 and 12, we're aiming to stage a festival on Coronation Field in May, June, where Bennetts End residents will be encouraged to come along, try a sport or a physical activity.
Thank you. Councillor Pringle, you wanted to ask a question?
Well, not specifically on that, but I think it all sounds really very good and hope we could all be doing similar things in our wards across the borough. But I had a more general question. Is it?
Oh, should we leave that?
Yeah.
So we'll
a ward question.
Yeah, we'll just carry on. So a further update we had from your ward as well was regarding the dangerous overflow car park at Bennetts End Surgery. And there's a piece of land at Bennetts End Surgery that I think at some point was a tennis court and is being used as a car park, and I know that's an ongoing issue. But the issue is it's an unsafe piece of land that is being used for parking.
It's probably not for here, is it? The substrate's gone because it used to be a tennis court, and Bennetts End Surgery was never planned for 16,000 patients. It's not just a Bennetts End problem, it's a problem for that particular part of Hemel Hempstead that straddles lots of wards, some of which don't have a GP surgery. So it's a vital car park now for Bennetts End Surgery, and unfortunately it's not fit for purpose, and we're trying to get the council to make improvements so that you don't have the irony of injuring yourself when you go and see the GP.
Yeah, just to add to that, I heard Edie just say that she's been there several times. You know, I'm very steady on my feet, and I won't park in that car park now because it is dangerous.
Yeah,
it's really dangerous.
Aware this
In the
issue.
last 3 or 4 months, it's collapsed a lot worse than it ever was before.
Who does it belong to?
It's Dacorum Borough Council own it, but it's not the GP surgery.
It's the GP
It's
surgery.
nothing to do with the GP surgery. It just so happens that it's behind it.
Yeah, and that's probably why I think it was a bit cheeky me raising it at the health committee, because it actually doesn't belong to the GP surgery. It's a piece of land that belongs to Dacorum Borough Council. However, it is primarily used by people who use the GP surgery, and I wouldn't like to see people who use the GP surgery use Bennett's Gate Shopping Centre car park, because that's going to then lessen the amount of car parking spaces it is for the traders, and people will just move on to another shopping centre where they can park.
And it will be noted here, and I'm aware that it's been raised elsewhere, so thank you.
Jay, you could pick that up separately with me outside of the meeting, yeah.
Thank you. And with regards to the, which I'll do your question at the end, Councillor Pringle. So with regards to the work programme, I wasn't sure if you just had a brief update on work programme.
No, only Chair that following our discussion yesterday in preparation for the meeting, we'll be meeting with the Chair in the next few weeks to scope out some suggestions for work programme to bring back to this committee for its approval. I think I'm keen that there's a lot happening right across the board, particularly with the new focus on wellbeing for this committee, as well as just looking at clinical care and so on. And we can programme just as we do with our other committees here at Dacorum members, you know, particularly our scrutiny committees and so on. They all have their own work programme, and we can plan a year in advance, obviously with the right flexibility as and when we need reports. And I'm sure Chair also regular reports back on the health campus proposal as well as that develops.
Yeah, and we will ensure if health campus reports will be circulated amongst the group when it's appropriate to do so. They will be shared. So it's just to let you know that updates will come here. So Councillor Pringle, you had a question.
Yes, I'm not sure about our remit within this, but my concern is about health inequality within dentistry locally. It's come to my attention that post-lockdown, the government wrote a letter. I haven't had sight of the letter, but it wrote a letter to all dentist surgeries that provided NHS provision. And it said that once the service returned after lockdown, that if patients on their NHS, if their NHS patients did not make their 6-month checkup appointment within 6 months of going back to normal, then they could be automatically discharged without warning. And my inquiries into this show that no reasonable adjustments were advised or made for people with certain conditions, such as mental health conditions, depression, communication problems, autism, special educational needs, memory problems, and furthermore, that the dentists themselves, that the those who, not the actual dentists, but the practices, felt that they weren't obliged to make reasonable adjustments for people. There was no advice in this letter that was sent out of they felt that because the government didn't write it, they therefore didn't have any duty under the Equality Act 2010, which of course they do. And one would have thought that the Secretary of State for Health would have brought that to the attention of the dentists. But now it appears that some of them have discharged swathes of vulnerable patients and have now closed their waiting lists. Now, as if someone took a cursory look at that, that might look as though there'd been some investment into dentistry that had reduced waiting lists, whereas in fact there has just been a complete denial of service to the most vulnerable people in our society. And it seems very concerning, almost irresponsible way for the Secretary of State to have communicated with dental surgeries. And so I would like our committee to have an investigation into that across Dacorum. First of all, to get hold of the letter that was apparently sent to dentist surgeries from the Secretary of State, and to make inquiries as to whether dental surgeries keep records of people with, because I know that when you register, you tick boxes and say what conditions you have. So people with memory problems, people with vulnerabilities, people who have special educational needs, because it seems that anecdotally, children with special educational needs have been struck off, and when the parents have contacted the dentists asking for them to be relisted, they have said that they spoke to their patient groups who thought that that wouldn't be fair to other people. Now that seems on the face of it to be a clear breach of the Equality Act 2010, and some proper advice needs to be sought and given to our local dental surgeries so that they can take proactive action to remedy what appears to be clear discrimination. And we should also be looking into this and writing to the Secretary of State and the Department of Health, who've written this letter, ask them to retract that advice and to apologise to people for the clear discrimination and the failure in responsible governance by warning the surgeries of their responsibility towards these vulnerable people in our society. If this has happened up and down the country, then it's an absolute disgrace and manipulation of the waiting list statistics.
Thank you.
Just ask if it would be helpful, Chair, to ask for the Department of Health's equality impact analysis on this issue.
Yes, indeed. Yes.
I'll ask our colleagues at the council to.
I'll take that away on Chair.
Yeah, thank you very much. Okay, so one more question, Councillor Patterson.
Does the letter to dentists from the Department of Health give any reason for doing this?
Well, I haven't read the letter. I've only heard of it. And apparently not. It's just, this is what you can do. You don't have to warn people that there's a deadline by which they must contact the dentist. Of course, a lot of people with the confusion after lockdown wouldn't know that the dentist had reopened. There wasn't a lot of publicity about that. And so it seems to be, if I was a cynic, which I am, I would say it was a clear attempt by the Department of Health to manipulate the statistics on dental waiting lists purely for political purposes and knowingly sacrifice vulnerable people for that purpose. And I would say that that is a derogation of duty by the Secretary of State, and not the first one we've seen in recent times. And it is entirely in keeping with the culture that we're hearing about in the COVID inquiry, and is part of that. And in fact, we should bring this to the attention of the COVID inquiry.
Thank you for raising that issue.
Thank you.
Points are noted. So with that, I think we'll call a close to the meeting. Thank you everybody for your attendance this evening and participation. and we will see you after the holidays. Have a very pleasant, happy holidays, Christmas, and Happy New Year. Thank you.